Hi, I'm Amanda Olson from IntimateRose.com, and I'm a doctor of physical therapy and a certified pelvic floor rehabilitation specialist. And a common question that we are asked at Intimate Rose about our vaginal dilators is, how do they help with vaginal pain during intercourse? And the answer to that is that the vaginal dilators, which we're now actually referring to as vaginal trainers, are used to help train both the brain and the muscles to be able to relax in order to accommodate an item coming into the vagina. So whether your goal is to be able to tolerate a medical exam or use a tampon or to be able to have sex, the vaginal trainer is an item that is used to help train your body to be able to tolerate that. So the purpose of the vaginal trainer is not to just get in there and break up scar tissue if you've had radiation or surgery, or to stretch out muscles that are tight and spasmed. The purpose of the trainer is to train the brain to relax the pelvic floor muscles here. So here's the pelvis. Here is the superficial layer of the pelvic floor muscles. What you can see here is we have the urethra, the vagina, and the rectum. Everything that you see in red here is a layer of musculature. And then likewise, we have a deep layer inside that backs up to that superficial layer. So those two layers of muscles oftentimes are experiencing spasms, tightness, guarding in women that have pain with sex. And it's not something you're doing on purpose. Or women in general, they're not purposefully clenching. They're not often aware that that clenching is happening until they try to have intercourse or use a tampon, and it feels like nothing can get in, and it's very painful and also very, very stressful and distressing. So the vaginal trainers come in graded sizes. So these are the smallest four here, the smallest being approximately 1 centimeter. And here are the largest four here, the largest being approximately 4 centimeters. So there's a progression of vaginal dilator to help you enter the system where you are and to gradually be able to train your body to tolerate larger items to meet your goals. So the dilators themselves are made of a medical grade silicone. There's a unique finish on this that I made specifically for my patients. After a decade of clinical practice treating women with vaginal pain, pelvic pain, I recognized that what was on the market was either hard plastic or a sticky silicone that was not comfortable. So this particular type of silicone eases the entry of the dilator during the training and the withdrawal, and also just is more comfortable all the way around. So for more training programs and a better understanding of how the vaginal trainers or dilators are used to help train the pelvic floor, you can visit our website at www.intimaterose.com, where I have other videos that discusses training programs and how to further overcome pain with sex.